talk about the precipitating factors for diabetic ketoacidosis in pregnancy. Now, we all know that diabetes is a condition where the insulin in the body is not enough to handle the glucose in the body. So, wherever the insulin is inappropriate as compared to the blood sugars, there is a condition where the body does not, the cells, they do not get enough glucose for their metabolic needs. Like, suppose we have a cell and we have glucose. Now, we will need this car, which is the insulin, which drives the glucose into the cell, and the cell becomes active. Now, if this car is defective or if this car is not working, then the glucose in the blood is not transported into the cells. So, despite having so much glucose, the body is not getting enough fuel. Now, in DKA, the insulin is so inappropriate that the body starts utilizing fat. And to make the cells happy for energy, the fat starts breaking down to give them energy. But we all know that will lead to excessive ketones in the body. And ketones are not good, people. They are very, very toxic for the body. So if the ketosis lasts long, then it will cause immense damage to the body. So that is the reason why diabetic ketoacidosis is not something we can be easy about. It is an alarm. It is an emergency. And so it is very, very important to handle diabetic patients carefully so that they do not end up in this crisis of DKA. So this is in a nutshell about the pathophysiology of diabetic ketoacidosis. Always remember, insulin is like a car which makes the blood glucose available to the cells so that they can use it for their metabolic activity. In case insulin is not appropriate and the blood sugars are very high, the body will start breaking fat due to inadequate insulin, due to lack of glucose, and the fat will lead to ketosis, and there will be a lot of issues in the body, toxic issues in the body due to this ketosis. So we have to be very, very careful in DKA patients that no precipitating factors are made available to the patient. Now, if you can see, this is our pregnant patient. Okay, as we can all see, she's got too much. This is protracted vomiting. Protracted vomiting is something which stayed for quite some time. It is not like one episode of vomiting. Protracted means it has been there for some duration of time. So now this lady, as you can see, she's pregnant and she's got protracted vomiting, and we all know that wherever there is vomiting for a long period of time, the body will get dehydrated, and again in dehydration the body starts using fat for energy, and again we will have ketosis. So any condition leading to dehydration definitely needs to be avoided if we are suspecting that a patient can land up into DKA. So we have to be very, very alert about protracted vomiting, or in pregnancy, to be very precise, hyperemesis gravidarum. So this is something that we have to avoid. Now, as we can see, this lazy guy in the lady's stomach. See, this lazy stomach is nothing but what we call as a condition known as gastroparesis. So obviously, when there is gastroparesis, the release of food from the stomach, from this lazy stomach, will be very lazy. So that will affect the blood sugar levels. The spike and the drop in blood sugar level will be affected. So definitely this lazy man or the lazy stomach in the lady, condition known as gastroparesis, will again lead to DKA. Now, this lady, if she's got infections, you can see now she's irritated, angry, because see, there's so many bad bacteria on her. So, again, when there is any kind of infection or she's in sepsis, again, we know that there is an acute crisis in the body. It is a stressful condition that can also lead to ketosis and diabetic ketoacidosis. So all kinds of stresses like dehydration, like infection, needs to be avoided in patients with diabetes in pregnancy. Now this lady, she is so dehydrated that she's come to have water from the pump. But see, this is all dry. Oh my god. So there is pump failure. Now, what is this pump? This is the insulin pump. That means she was taking insulin for the management of her diabetes, but for some reason the pump has failed and she's not getting adequate insulin. So, in those cases, again, the lady will land up into diabetic ketoacidosis. Again, she was going to a friend. This is her friend, but they had some fight. Now this friend had insulin, but she's what? So she's got mood swings in pregnancy. She's not going to the friend and she's missed her insulin doses. So pump failure or missing the insulin doses or non-compliance with insulin again will make insulin unavailable or inadequate for the management of diabetes, and the lady will land up into diabetic ketoacidosis. And last but not the least, let's not forget these laddus. What are these laddus? Any kind of drugs which will lead to hyperglycemia. Anything, any kind of drugs which will precipitate diabetic ketoacidosis, some things leading to overshooting of blood sugar levels. So you have to avoid all those medications which can lead to hyperglycemia or DKA. So this is a story of a lady who has been vomiting protractedly as well as or having hyperemesis gravidarum, and now she's become very lazy due to vomiting, and the stomach has become lazy, and she's got gastroparesis, and because of so much of problems that she is having, she's got infections. Bacteria think that now she is a good target to be attacked on, so she's infected and infections, and now she is very dehydrated because she's vomited so much. So she wants to have water from the pump, but the pump fails. That is the insulin pump failure. And now she was taking insulin, but she has a fight with her insulin friend, so she's missing on her doses. So insulin is again inadequate in her body, and she is very prone to land up into DKA. And with all these conditions, she wants to have laddus, but we cannot give her laddus because any drug which can precipitate DKA has to be avoided. So drugs causing DKA or hypoglycemia are again precipitating factors for DKA. Thank you.